Hi, with this video, we will get a quick overview of a seed project that targets mitigating health inequalities in the Kronoberg region. First of all, let's know about what is a seed project. It's basically an initiative by one of the knowledge environments that we have at the Linnaeus University to support the research in different directions and specifically involving interdisciplinary researchers from different departments, including engineering sciences, social sciences, humanities. So yeah, and the idea with this seed project is like it's a kind of a pilot studies that brings researchers together to develop their project. So it's a minor project that is, as I said, that and the goal is to identify new or deepen existing collaborations and explore possible future research. So one of the goals with this seed project is that to bring the researchers together and then go for a bigger project. So and this seed project that we will be learning. Knowing through this video is one of those seed projects under these knowledge environments. So the problem that we target with this project is health inequalities, which is we believe is well, not something new. It has been a problem before, and it's a significant societal problem that need to be addressed. And in Sweden, well, this problem doesn't not only exist, but has been in the last few years. It has been noticed that the problem has been even more than in the previous years. And the Swedish national public health policy aims to abolish some of these disparities in the healthcare that could be avoided. But it's not a simple issue; it's a complicated problem, and we believe that it requires coordinated efforts, both at national and the regional levels, involving multiple stakeholders, including researchers from academia, practitioners in the field. With this seed project, we have basically two major goals or the aims. At first, we would like to identify and analyze what are the factors and the barriers or the unmet needs that are causing these health inequalities. And in this, since it's like a seed project, we will have a focus only on the Kronoberg region. And even in the Kronoberg region, we will have focus on more on one of the regions, one of the areas in Växjö city that we call Arabi area, just to make sure that we don't target so much because it's a very limited project. And then the second goal with the project is that once we have identified the factors that are causing inequalities, we should analyze what have been the existing solution or the procedures and practices that are being followed to address these problems, the problem of health inequalities. And then also, I mean, what are the areas, strengths, and weaknesses of this solution and the procedure, and then identify the needs and requirements for how we could develop digital solutions. So the goal with this, because it's the project is under the digital environment, digital transformation environment. So the goal with this project will be more specifically to find out how we could use technologies and digital solutions such as apps and other web-based solutions to kind of avoid or mitigate some of these health inequalities. The approach that we plan to follow in this project is that at first we need to identify the stakeholders, and then after identifying the stakeholders, we should collect the data from those stakeholders based on. And the aim with collection of the data is to identify the factors and the barriers that lead to the health inequalities. And then based on that data, we can identify the needs and the requirements for the digital solutions. And once we are done with them, because this will help us to understand what are the factors, what are the the root causes, what are the causes to the health inequalities, and what are the needs for the digital solutions and how digital solutions could be used. And once we know all those things, we plan to develop a digital solution as a prototype and then we will also present this prototype to get the initial feedback to the stakeholders to see what do we, what is their opinion on the designed or the developed prototype. And some of the results that we expect from these projects include that we would like to have established and strengthen the partnership with different stakeholders. So the goal is to create a partnership framework among researchers and the stakeholders, so that in the future, I mean, as it's the seed project, so and the idea is that to later on in the future we should continue with the project and aim for more. Maybe expand this to the other parts of the Sweden and the other areas of Kronoberg. So that would most likely require more resources, fundings. So we plan to establish a more sound partnership collaboration with different researchers and stakeholders, and then apply for external funding. So that will be the one of the results that we want to achieve with this seed project. Yeah, so the others are, as we mentioned in the beginning, that we would like to identify the factors, barriers, and needs that lead to health inequalities, and we would like to analyze. Yeah, the analysis of these all the different factors and barriers and needs, just to get a better understanding of the problem. And finally, we would also need to identify what are the needs and requirements for new digital solutions to mitigate health inequalities. So that is the time plan for the seed project. So it's just 1 year, so time limited, and also that's why we call it it's a seed project. So the project officially started in 1st of September 2023, and the official closing date is the end of August next year, 2024. So far, well, as the focus is to involve researchers from different departments at the Indian University, because we believe that all these different departments bring different knowledge and views to the project. So we have people from the computer science, health and caring sciences, social studies, and informatics in the project. So here are the investigators, and I'm myself, Nadim Abbas. So I'm the principal investigator together with Chiara Linza. So I work at computer science department, and what Chiara Linza, who is also the principal investigator, she works at the health and caring sciences. And then we have Linda Sofia Fisnik from social studies, health and caring, and Department of Informatics. So to help us and advise us on the project, we have 3 advisors. Cecilia from the health and caring sciences, Maro from computer science, and Hemant again from the computer science. Apart from these, we expect these stakeholders as the possible, the people or the organizations who would like to collaborate. This is not the final or the ultimate list. This is what we expect. But however, throughout the project, we will learn about maybe some other stakeholders that we at the moment don't include here. So these include Region Kronoberg and Växjö Commune, Landshusen, and Red Cross housing companies here in Växjö. Plus, we also, because the focus, as I said in the beginning, the focus will be in the Dalbo area, the Dalbo locality in Växjö, Räby area. So we would also like to include the mosque in the Dalbo and the neighborhood Ulriksberg Church and some community organization, because we believe that this is really a community-based societal problem. So it would be good to have people from the communities, such as these mentioned here, Torgård, and to be involved in the project. And in addition to that, we would also like to involve the practitioners in the different healthcare or the ward centrals, including the doctors and the nursing staff. So that's it. Thank you so much for attention, and yeah, we look forward to the project.